United States is in the middle of a maternal health crisis. Maternal mortality rates have increased steadily over the past 2 decades. And the CDC's latest report says 2021 saw one of the worst rates in U.S. history, with more than 1,200 deaths. That's a 40% jump from the year before. So joining us now is Dr. Jessica Shepard. She is the Chief Medical Officer at Verywell Health and a board-certified OBGYN. Dr. Jessica, I want to call you Jessica because we know each other personally, but it's really good to see you again. This is such disappointing news, and sadly, it's not that shocking. 60 Minutes did a really sort of informative report. It aired last night on the topic. I want to play a little sound from that.
You've looked at this as a doctor, as a policymaker. What needs to be done?
We have to prioritize motherhood. Right? As a country, we have, and particularly in the Deep South, said that we're pro-birth. If we're really going to be pro-birth, we need to be pro-motherhood and pro-family.
So listen, you are in the South now, but I also know that you've worked in other areas of the U.S. I want to talk a little bit about what you've seen in the South as well as other areas.
That's a great question. Having worked all over the United States, I do see a very stark difference in how we approach women. And that was exactly what we saw in that clip, was prioritizing motherhood. And I think if we really were to take women's health and understand the key word in that phrase as women, is to understand that this mortality that we're seeing in maternal deaths, and 40% increase from 2020 means that we are doing something that is not helping women and not helping them, especially during the term of pregnancy.
Mm-hmm. When you hear prioritize motherhood, what does that encompass? Because I think there is a tendency when we talk about pregnancy to only think about the 9 months when a woman is pregnant. But the health of the mother before and the health of the mother after, not just her physical health, but her mental health, these are all things that should be accounted for.
And even when we look at that increase in maternal mortality as the highest income country and a wide disparity by race, we also know within the African American community, despite income, despite the walk of life as an African American woman, you're still going to see that increase in maternal mortality. And so what that means is, one, we need to pay attention to women of color, specifically Black women, but also looking at some of the resources and access that they have and watching why this may be a decrease in the comprehensive of high quality maternal health services. And also in the postpartum phase, as you mentioned, Anne Marie, we really need to do a better job at extending that postpartum coverage, whether that's looking at maternal hotlines, also strengthening and expanding in the work community how they approach women and the ability for them to stabilize their health after a delivery and the time frame in which they get to stay home with their babies.
Right. I think, that is so important. When we look around the world, we see that, time off, leave after having a child is much longer than it is here in the U.S. And physically, your body has to recover. You created a whole other human. It takes time. Exactly. One of the things that they talked about, Jessica, in that 60 Minutes piece is the increased bans on abortion, and that will have a ripple effect on maternal health. Can you explain how, access to abortion is connected to maternal health?
Absolutely. I always start out with saying that abortion is healthcare. And if we can really take down all the barriers that give us that actual key sentence of abortion is healthcare, that's where we'll start to see taking away the stigma, being able to have women make decisions for themselves about their bodies, and also who are the key decision makers in these systems of care, and taking accountability for women's health care and also the access and resources, but the ability to actually access the health care. So once we really look at the expansion of what women are able to do with their bodies and the care that they're given and the resources, we'll see that we really will start to embrace the woman during pregnancy if she decides to terminate, and also how we can allow women in all various parts of the country get the same amount of access. And when we look at racial disparities, taking away the stigma, and also why Black women are dying so significantly during pregnancy.
All things that really sort of need urgent addressing. Doctor, because I got a little
Absolutely.
casual there for a second there, Dr. Jessica Shepard, thank you very much.
Good to see you, Anne Marie.
Good to see you too.